Okay, now we're going to do dental examination and maybe some dental diseases along the way. So we'll look at anatomy of the teeth, the equipment we use, how we examine the teeth, classifying different dental disorders and their treatment, endodontic therapy. So endo means inside, dontic means teeth, so inside the tooth. So like dental crown restoration. Oh no, sorry, and this is the next kinds of treatment, sorry. Dental crown restoration, calculus treatment, and dental extraction in horses. Obviously, these aren't the same as small animals, so I don't think descaling is really something normal here. So anyway, when asked in the exam, because this was one of the MCQ questions, horses have hypsodont teeth. What does that mean? They're long crowned, meaning the part that isn't in the gum is long, and they have a short root, so the part under the gum is very short. Unlike humans who have brachiodont teeth, so humans, they have a very short amount sticking out of the gum, whereas they have a longer amount under the gum. And what they also have is what we call the reserve crown, which is in the alveolus, and the exposed crown is the part of the tooth above the gum line. And throughout their life, the reserve and the exposed crown continually wears off and they become shorter and the roots get longer. So basically, the part above the gum gets shorter over time because it's worn down, whereas the part below the gum actually gets longer, which is kind of gross if you think about it. So deciduous teeth, if you need the dental formula, 2 times kind of goes without saying because you have the upper and lower teeth, but they're exactly the same. So you have incisors 3, 3, so they have 3 incisors to cut the food in front. They have 0 canines. We'll discuss that more though. Then they have 3 premolars, 0 molars. So basically canines and molars are the same. Premolars and incisors are the same, but this is only the deciduous temporary teeth. When they get the permanent teeth coming in, incisors don't change. Canines can come in. It depends if they're on the horse. I don't think if it's their male or depending on the horse, I'm not sure. They get an extra premolar and they actually get 3 molars. So it goes from 24 to 36 to 44, but it depends on the horse. Sorry, there's a lot of just writing, but I'll try and stick to pictures as well. So the enamel, basically, it's the white layer on the outside of the teeth, and it's almost transparent in color, and it's determined by the underlying dentin, which is sort of the yellow layer underneath the enamel. So just if you talk about layers, you have the pulp, then you have the dentin, which is yellow, then you have the enamel, which is white, and it's covered by cement with the exception of the occlusal surface along the rostral surface of the incisors. Cement is, a mix of organic and inorganic ingredients. I don't know if these percentages are important. And water. Dentin, so most of the teeth is made up of dentin. That's the same with us. The enamel is just the surface layer. And 30%, that's fine. Dentin is stained by pigments in the grass and grain, which is why horse teeth are like gross. So it makes the teeth like dark brown on the dental star of the incisors and the occlusal surface of the cheek teeth. So we'll talk about, I think it basically means like this surface of the tooth. They call that the dental star or the occlusal surface of the cheek teeth. So these are the premolars and molars. So the pulp cavity is kind of what I said. It's like the inside of the tooth. This looks like the outside. Oh, there you go. Yeah, so this is the tooth cut in half. This shows the inside of the tooth. This is the pulp cavity. So you have fibroblast, collagen, blood vessels, secondary dentin deposition and nerve endings, which leads to sensitivity, and also blood vessels. The incisors, so these are the teeth in the front that cut the food. It has an infundibulum. So this is a recess or well on the occlusal surface of the tooth towards the lingual side. So, you have the outside of the incisor towards the tongue. The infundibulum is there. You have a cup. So this is what we call the dental star on the surface of the tooth in the folding of the enamel on the labial surface. A labial side of the occlusal surface of the tooth. And dental cups, basically it says I1, I2, I3, so I think it's sort of the depth of them. So if it's like if they're 5 years, incisor 1 is, because they have 3 incisors, apologies, so if they have cupping on the first incisor, they're 5 years old. 2 incisors, they're 6 years old, and 3 incisors, they're 7 to 8 years old. So I would remember 2 times 3 is, for the second incisor is 6 when they're 6 years old, and then just take 1 year off and add 1 year on for the other ages. I don't know if that helps. Anyway, so for the canine teeth, they said flushes. Maybe that's another word for it. I have no clue, but it's a single rooted tooth that basically protects and attacks. They have no crown cement and enamel in the foldings. They do not anatomically oppose each other, but they are very likely to get tartar formation, and they're often smaller or absent in mares, which is why I mentioned they're mostly in stallions. Wolf teeth, what the hell are these? So again, they're kind of like the canine teeth. They're not always there. This is your wolf tooth. So it's barely there. So yeah, it's not always present, or they have a different location, and they're like brachydont teeth. So I'll show you the word. So what brachydont teeth are like ours. So like the crown is very small above the gum, but like longer underneath. Sorry, but there's more underneath, sorry. Anyway, so the maxillary upper ones are significantly larger than the mandibular ones. Let's pretend there's one here. No, I was checking the other one. And yeah, the maxillary ones erupt around 4 to 7 months of age, and the mandibular ones 6 to 12 months. I'll show you the numbers. Maxillary, mandibular, and it has 1 root, and it very rarely has 2 or 3 roots, a bit like the canines. Now the cheek teeth, these are the premolars and molars. They honestly look hideous to me, but let's discuss this. So the second, third, and fourth premolars and all molars. So just to recap, second, third, and fourth premolars and all molars are all referred to as cheek teeth or buccal teeth, because obviously they're in the cheeks or buccal area, and they have complex enamel folds, as you can see, on the chewing surface of the enamel. The lower cheek teeth, so the mandible teeth, have one continuous enamel ribbon, like that. So the mandible teeth look like this, the maxillary teeth probably look like this, while the upper cheek have, yeah, the outer layer that encloses 2 enamel ribbons, so like that. And yeah, the mandible cheeks have 3 deep recesses, I assume it's these, 2 on the lingual and 1 on the buccal surface. So I'll show that to you. 3 deep recesses, 2 on the lingual, so 1 on the medial side and 1 on the buccal surface, so towards the cheek, and maxillary cheek have 2 infundibula. If you don't remember what the infundibula are, these are the recesses, okay? Yeah, am I on the right side? Okay. Okay, so we'll talk about cheek teeth and then we'll stop. So cheek teeth. So the maxillary cheek teeth, so the upper jaw, have 3 roots, 2 small buccal roots, so 2 small roots in the cheek area, and 1 large palatal, but sometimes 4 roots, which is a bit crazy to me. The mandible cheeks, okay, they don't show the lower jaw, but let's pretend it's there. The mandible cheek teeth have 2 equal roots, 1 rostral, so this end, and 1 caudal, except M3, which has 3 roots. That's easy to remember. M3 has 3 roots, 3, 3. The roots of the maxillary cheek, so the roots of these cheeks, have 3 to 6 maxillary sinuses attached to them, so sometimes you can access them through them. And the maxillary ones, they're wider and square, and the mandibular ones, they're narrower and rectangular, and they grow 2 to 3 millimeters per year. We'll stop here.